Welcome to Marian Ayurveda. In this first episode, we are going to think about one of today's biggest problems, knee pain, which is a major concern for many people. Many are faced with the dilemma of whether to undergo surgery or not, or whether it is possible to find a solution through Ayurvedic treatment. A lot of people come to our OPD with these questions. I am Dr. Anumod Kakkassery from Marian Ayurveda, Thrissur. Many times when people come to me who have been advised to undergo knee replacement surgery, I find that 9 out of 10 of them actually do not need it. With treatment, they have been able to walk comfortably within 17 days or even just 10 days. However, there is a small group of people for whom treatment does not yield results. How can we understand this? Whether it is possible to understand this is what I wish to talk about in this first episode. What I always say is that by looking at just one X-ray, we can accurately determine whether a person needs a knee replacement or not. Once a person came to see me. She was an elderly woman who could hardly walk. She came insisting that only a doctor's treatment would help. After I looked at her X-ray, I said there wasn't much of a problem and that we could treat it if needed. But still, I had a doubt after seeing her knee, so I asked how the X-ray was taken. Then they said, "We took the X-ray while sitting." But what I understand is that only when the X-ray is taken in the correct position, that is, in the standing position, can we really see the gap between the knees and how much the bone has worn away. So I told this person that before I start treatment, I need to say one thing. You should go and get the X-ray taken again. When they did as I said and took the X-ray again, it was not like what we saw the first time. There was a difference in the condition. By then we could say that there was almost no cartilage left between the bones. In such a case, it is a situation where both bones are almost touching each other. I told them that if we proceed with treatment in such a case, we will not get any results. In my opinion, by not doing this and opting for Ayurvedic treatment now, you are just avoiding wasting your money because this is a case where there is almost no chance of getting a result. If someone insists a lot, I still wouldn't do it because even if you do it, you might feel better for a week, but then you will go back to the same old condition. At the same time, just a day ago, a patient came in, barely able to walk, needing support because of knee pain. But when I examined the knee, I noticed it was swollen and filled with fluid. After suggesting an X-ray and getting it done, I realized that there was still good cartilage in between and the joint space was not problematic. The main issue was the fluid accumulation. The bones were generally healthy, though there were some age-related changes, but it was a case where we could correct it. After just 2 or 3 treatments, she was able to go to the bathroom and walk without support. What we did was use a key medication that helps drain the fluid. After administering this treatment, the swelling quickly reduced and she was able to walk comfortably. Similarly, another person age 60 came in. At that time, this person too had been advised to undergo knee replacement surgery, but after examining this person, I noticed that the quadriceps, that is, the anterior muscles located at the front of the thigh, were all out of position. Because of this problem, this person was unable to squat, walk, or do any work. The biggest issue was not being able to climb steps. When we examine people who are unable to climb steps, we always check their muscles. When we look at it with a Wilson test, we often find that its position has shifted. In this person, there was no fluid in the knee, but when we took an X-ray, there was a space between the 2 knee bones. So we told the patient that we could fix this. It only takes a very short time to correct a muscle. Just 2, 3, or 4 days is enough to set it right. Once we corrected these muscle anatomical positions, this person started to feel better. He was able to climb steps, walk, and do all the household chores at home. This is a case just like that. Once a person came in. The child was only 35 years old, and similarly, knee replacement surgery had been recommended for this person. Since I was young, I had a lot of confidence. I felt confident that we could do it and fix it, but after taking the X-ray, we saw that the entire cartilage had worn away. For this age, to have such a condition is quite unusual. It's not something that usually happens so easily or commonly. When I investigated further, I found out he was a football player. While playing football, he had a muscle injury, and I think because of that, all the mechanics got misaligned. I feel that if both our knees are like this, when the alignment is off, this is what happens. With repeated rubbing and friction, suddenly the entire cartilage wore away. In this person, the bones were almost touching each other with hardly any space between them. I said, if we do the surgery, won't we get results? So we decided to support that young man for surgery. In many of these clinical scenarios, just by looking at the X-ray of the knee in such cases, we can often accurately determine the prognosis, specifically whether this condition will eventually get better or not. When someone experiences knee pain to the extent that they find themselves unable to walk, we can observe quite a lot of diagnostic information up to a certain point. The internal swelling that occurs within the knee joint is highly significant. It can be quite severe and physically debilitating for the patient. It is because of this swelling that they are unable to walk beyond a certain point. So by removing this swelling itself, we are succeeding in the initial stage. Some people may not have swelling. For them, the problem will be with the muscles, so we correct the muscles. There are certain individuals who suddenly experience a loss of calcium in the bones. If we observe them, we can see this. People who have severe gas problems or acidity issues, no matter what they eat, those with more acidity or gas problems, are the ones in whom we can often see a sudden loss of calcium in the bone. This kind of thing happens in two ways, either due to acidity or when people say they get gas from eating lentils or tapioca. One reason is that the food is not being digested properly. If proper digestion does not occur, the necessary nutrients will not reach the body or the bones, or the nutrients will not reach the cartilage. What we call degeneration is, as mentioned, either the bones are not getting enough nutrients, or the nutrients are actually being depleted. This is what I have understood from my own practice. So these are issues related to the stomach. We can understand that such people are quickly dismissed from every decision. For such individuals, what we do is give medicines that correct their digestive system, especially in cases where acidity or gas problems are persistent. Sometimes, no matter what treatment we try, it may not always succeed. Their bones are not getting enough nutrition. That's why for these people, we need to correct the gas problem first to address the underlying issues. Only then, even if we give them medicine to improve their bone health, it will actually be absorbed by the body. So initially, what we need to correct are the digestive problems. Once these digestive issues are resolved, then we proceed with the next step. The next step is to strengthen the muscles. Now we know that after a certain age, people tend to lose muscle. By the time they reach 60 or 70 years old, all their muscles start to sag. Especially if we look at elderly women in our homes, we can often see that the muscles at the back of their legs hang loosely, almost like a ball at the back of the knee. These sagging muscles severely affect the mobility of the leg joints. We often massage these muscles upwards, but when we massage downwards, the knee tends to lock again. Even when we massage upwards and try to strengthen the muscles, as people age, their muscles become weak very quickly. We know about this sagging condition. Among the elderly, everything seems to hang down and we can see their thigh muscles drooping. For such people, walking becomes very difficult. However, by providing specialized medical treatments that strengthen even the smallest muscles, the muscles become much stronger over time. As a direct result, these individuals are able to walk independently. Similarly, there are many therapeutic treatments that help to strengthen the joints. Once these treatments are completed, both the muscles and ligaments become remarkably strong, fully enabling people to walk again. So it is with these kinds of treatments that we treat a person who has knee degeneration or is unable to walk. Similarly, with internal medicines, it is very difficult to achieve cartilage regeneration, but even so, when taking some of these medicines, we know that in people with degeneration, there is often a loud cracking sound inside the knee, right? We call that sound crepitus. Those cracking or grating sounds are what we refer to as crepitus. For those who have symptoms, by taking medications internally and through various treatments like physiotherapy, we are often able to reduce that crepitus sound. So by doing these kinds of treatments alone, I feel that to a great extent we can avoid having to go for major surgery. Then, as I mentioned earlier, to prevent further degeneration by taking medications that stop the progression of bone loss, we are able to arrest the condition. So I feel that there are very effective treatments available. In our experience, we have seen many people who never needed surgery. For example, once a lady came in and she was extremely anxious because she was unable to walk. The doctor had told her that she needed a knee replacement immediately and all that. But when I examined her, I realized that her knees were actually quite young. She was only about 40 years old. What I understood was that her problem was actually with her muscles. In fact, it was an injury to her calf muscle that was making it difficult for her to walk. After thinking about it, I found out that for the past 2 months, she had been wearing high-heeled shoes. As a result of this, there was a change in the position of the anterior tibialis and gastrocnemius muscles. Some strains or muscle contractions had developed there, and that was the main problem for this person. While sitting in the OP room itself, in just 5 minutes, we addressed that muscle issue. After correcting its position and giving a massage, this person left the OP with great surprise at how well they could walk. As I've said many times, with very simple treatments, we can often avoid knee replacement or solve knee problems. We'll see each other again in another episode. Thank you.